Hey guys, it's Dr. Nate here with Dr. Nate Health. So before you keep scrolling, this video today is honestly made for everyone. Whether you or a loved one have or have not yet had to make the decision on whether or not to go through surgery for your pain or your injuries, I'm going to kind of educate you, and this really strikes home with me because I see it day in and day out where it's ruined people's lives. Now, this isn't going to be me bashing it because I'm for it, but I just want to share my experiences and want to tell you, hey, these are some other things, some other options you may want to consider when you do face that decision. So stay tuned. Yeah. Okay, so surgery. We'll kind of focus just for this video specifically on like spinal surgeries or things like that. I recently had a patient that came to me, and I've seen this time and time again. That's why I'm making this video. I've really been trying to think of videos that you guys want to see or be educated on, and I've kind of been hitting a standstill as well as planning a wedding and all that. But anyway, I was like, you know what, I'm just going to share some of my clinical experiences and things that I've been seeing consistently. So this patient in particular had a previous shoulder surgery, went great, no pain, no complications. And so then they started having back pain, and they were told, hey, you can get back surgery. You know, the pain started going down their legs, and they started having radiculopathy, and they were told, hey, this back surgery, it can make you feel better. So they get the back surgery thinking it's going to go as good as, and this was about 8 years ago, as good as the shoulder surgery, and it didn't. This leads down a rabbit hole, and long story short, the patient ended up getting the surgery, still had the same pain going down the legs. They had these titanium screws in their back fusing L4, L5, and L5S1 of the lower lumbar spine, and it didn't solve the pain at all. They ended up getting addicted to opioids. That drastically changed their life. They had to go through addiction counseling and all that. It's been 8 years, and they're still suffering from the same pain. I share this story with you because the ideal situation for that is they would have at least tried a conservative trial of care. You think pain going down your legs, or not just you, but people in general, they're like, oh, I need surgery, it's gonna fix it, I'm gonna be good. And we're in a culture where we want this quick fix, and sometimes it takes a little bit more time. I've also had a lot of patients that haven't gotten the surgery. We do some conservative care, and they've responded really well. They no longer get the pain in their legs. Now, it's not 100% every time, but ideally, before you go the route of drugs and surgery, you do a conservative trial of care. So that's really, really what I recommend. And I wish I could have seen this patient before they had that fusion in their back, because that's not gonna fix the problem. The opioids aren't gonna fix the problem. We wanna get in there, we wanna get motion. But at the same time, I had this patient in front of me. He was in pain. His life had been wrecked by opioids and the surgery, which isn't always the case. But surgeries aren't guaranteed. They never are. So we mobilized above the surgical site, as well as the pelvis still moves. Even if you have the lower lumbars fused, the pelvis still moves. We did some soft tissue work the first day because I didn't want to get into aggressive treatment before I had reviewed his MRIs. He also had a neck issue where he was getting numbness and tingling, a C8 radiculopathy into these two fingers right here on both sides. So before I treated him and adjusted him, anything like that, I wanted to review the MRIs. So we started very gentle, very soft. But after that, I was like, okay, I feel comfortable treating this patient. So went ahead, did my typical treatment. He's responding great. His neck feels great. He's not getting the tingling. The back we're still working on, but he was pain-free last time he left my office, which is the first time in over 10 years. He had the surgery 8 years ago. So this isn't me being like, oh, this is what I did. No, it's more so just to educate you that, hey, there are other things. They're not always instantaneous, but at least give conservative trial of care, meaning not drugs or surgery, a shot before you go down that route. Because drugs and surgery specifically, isn't always the best choice. It's the quick, easy, sometimes it goes great, but sometimes it doesn't, and then there's, you're altering the body in a way that you can't change it back to how it was. And I've seen this numerous times with my experience at the military base before. I've literally seen people who just had little injuries from picking something up off the ground to people that have been blown up. So there's times when drugs and surgery are great after a failed trial of care. If certain neurological signs present, those are things that we look for in our exams. But that's just a little pointer I wanted to give you guys. If you or a loved one are having pain, really go get it checked out by a specialist and see whether it's your shoulders, it's your elbows, low back, neck, anything like that. Conservative trial of care, I would highly, highly recommend, and that's really what the industry standard is going towards before seeing a potential cut happy surgeon. And this is in no way bashing surgeons. I've seen some great surgeons do some great work, but this is just planting the seed for something to consider when you or a loved one are faced with that really tough decision. Now, the surgery may be a great option, but it's never 100%. Even the simplest surgeries can go wrong. And this isn't me scaring you out of anything. This is just me educating you. There is another option. But sometimes we just want that quick fix. But this is just something to consider. Let me know what you guys think below. Also, like I said, I've been trying to think of video ideas for you guys. I've kind of slowed down a little bit with wedding planning stuff here in 2 weeks. But yeah, feel free to comment down below or reach out to me. I'm genuinely just sharing my knowledge with you guys. So other than that, I hope you guys have a great weekend. All right.